in South Africa die from tuberculosis than any other disease. On average, 40,000 South Africans die of TB every year. TB is transmitted in the air. This means we can all catch TB. We want every person to screen for TB at least once a year. The signs of TB are coughing for more than 2 weeks or for any other duration if you are HIV positive, having fever for more than 2 weeks, unexplained loss of weight, night sweats, fatigue among children. If you have any of these signs, go to your nearest clinic to be tested for TB. TB is curable and medication is free. Live a healthy lifestyle. Don't ever smoke. Join the massive TB screening campaign. South Africa, we can beat TB.
Oh, that's the message from our minister. Tuberculosis remains the leading cause of death in South Africa. Yesterday, the Health Department renewed its efforts to tackle TB by partnering with USAID in a nationwide campaign to raise awareness. The initiative is spearheaded by our Health Minister, Dr. Aaron Motsoaledi, who just happens to be in studio with us this morning. Good to have you, Minister. Thank you very much for being our guest.
Thank you, Leanne, and good morning to the viewers out there.
You know, it's unbelievable. We talk about TB so often, and yet, as we're reporting, it is still the #1 killer. Where are we going wrong? What's happening?
It is definitely the #1 killer. Leanne, you know, the whole world, we had thought we have defeated TB. That's why over the past 50 years, there were no new diagnostics for TB. For a period of 50 years, we're using the same thing. Whereas with other diseases and in other branches of medicine, you know, they were inventing new things. For the past 50 years, there was no new treatment for TB. We used the same treatment for 50 years. But with the advent of HIV and AIDS, everything changed for the world. TB came back with a vengeance. And that's why we find ourselves where we are today. Remember, in South Africa, we have got the highest HIV/AIDS prevalence. But in our case, we also had a problem. We were the biggest gold-producing country in the whole world, remember. Now, many of the gold mines are closed. They've left dumps there, which are spewing a lot of silica dust because people who are working in gold mines or staying around the gold mining communities are very vulnerable to TB. So we have got two vulnerabilities here brought by HIV/AIDS and the mines.
Yeah. So those are the big things that we need to work around. So we know what the causes are. How do we get around that, though? I mean, what do you continue to tell South Africans and to help stop TB?
Well, that's why we want them to screen. Let's go back to 2009 when the country turned the corner about HIV and AIDS. At that time, we were a pariah of the world. Everybody thought everything is lost. People were dying left, right, and center. Yeah. But we started afresh. And we launched the biggest HIV counseling and testing campaign. We tried to fight stigma. We asked South Africans to go and test. And within 18 months, 18 million South Africans has tested and known their status. And we started treatment. In 2009, we were having only 923,000 people on treatment. Today is about 3.4 million people who are on treatment. Now we want to do the same for TB. At the HIV/AIDS conference in Australia, Melbourne, last year, we adopted the 90-90-90. The world adopted the 90-90-90 for HIV/AIDS, meaning 90% of the people must know their status, 90% of those who are positive must be on treatment, and 90% of those who are on treatment must be virally suppressed. If we reach that stage, which we believe we'll reach in the world within the next 15 years, then we'll say HIV/AIDS is over. Now, I happen to be the chairperson of the International Board of Stop TB Partnership. And in a conference, a union line conference in Barcelona in October last year, when I was a guest speaker, I asked a question to the conference. If HIV/AIDS can adopt 90-90-90, why can't we do the same for TB? Yeah. Why can't we put up and say for the next 15 years, we have got 90-90-90 for TB? Meaning what? Meaning that 90% of areas where people are vulnerable, they have to be screened for TB and know their status. Yeah. And 90% those who are found to have TB, let's put them on treatment. and 90% of those who are on treatment must be cured, because TB is curable. Unlike HIV/AIDS, which is lifelong, there's a stage in TB when we say now we're stopping treatment because you are cured, you are cleared of the disease.
Yeah.
So we can do that to 90% of those people who are on treatment. Then we can defeat TB.
Now, I know that we're not stopping and we're not becoming complacent about all of this, and these goals are huge, and that's why it brings us to partnerships that are needed. This partnership with USAID, what is it all about?
Well, we're partnering with many development partners, but for this particular exercise of advertising and screening for TB, we're working with them. We do have quite a number of development partners all around the world. The World Organization itself, UNAIDS, USAID, PEPFAR, etc., Global Fund, we're all working together to make sure that we fight these diseases.
One of the big issues, however, is the shortage of TB medication. And you talk about the fact that it is freely available, but you get people going to some of the institutions to get their medication, it's not available. How is this going to stop? And also TB behind bars, it's another big issue.
Yes, there are three areas where, three communities that are generally vulnerable to TB in South Africa, which we have identified. One is people in correctional services. 150,000 of them. That's why we have targeted them, all of them, for screening. And I can assure you we have already screened 66,000 of them out of the 150. That's the first vulnerable group. The second vulnerable group are people working in the mines, especially the gold mines. Now, people working in formal mines in South Africa are 500,000. And we have also started screening them. We have actually hired 9 inspectors. Mm-hmm. So that the mining bosses themselves must do the screening and the inspectors must inspect to make sure that that's happening. And we're satisfied. The last time we checked, in more than 90% of the mines they were doing so. The third vulnerable group, which is the most problematic, are people who are staying in what are called the peri-mining communities. The people who are staying around districts which have got intense mining activity. And we've identified 6 districts in South Africa. The first one, which is number 1, is Livelipuzwa in the Free State, around Velkom, Virginia. If you can see the mine dumps there, you'll understand why it's number 1 district. Number 2 district is Kenneth Kaunda district in Northwest, around Orkney, Potchefstroom, also because of gold mines. Then comes Waterberg in Limpopo, around Lephalale.
Okay.
Yes, and then comes North Rand here in Gauteng, around Carletonville.
Yeah.
And then from there we've got Bujanala in Rustenburg, and then last is Kukune in Limpopo. These are the 6 districts we are focusing on.
Minister, thank you for talking to us. I'm sorry to stop you there, but we've got to get our news headlines. But the reality is that there's a lot being done by our minister to try and stop the scourge of TB. Thank you very much for being with us. That's our Health Minister, Dr. Aaron Motsoaledi. Let's quickly get straight into those news headlines now.